Hello everyone, welcome back to the question answer discussion session. So today's question is basically regarding the antidote, and the question is antidote for ethylene glycol poisoning. A choice ethanol, B choice pyridoxine, C choice nitroglycerin, D choice fomepizole, and E choice sodium thiosulfate. So before coming to the correct answer, let's understand what is an antidote. So it's a remedy, basically it's defined as a remedy to counteract, it's a remedy to counteract the harmful effects of, counteract the harmful effects of drug poisoning or drug toxicity. So basically it's a remedy to counteract the harmful effects of drug poisoning as well as drug toxicity. Now let's come to some important drug poisoning and the antidote used for that. So in the case of methanol poisoning, the antidote is fomepizole. Fomepizole is the antidote for methanol poisoning. In the question, the choice, if fomepizole is not there, you please look for the choice ethanol. Okay, normally ethanol is not preferred, fomepizole is the preferred one. However, if the question does not contain fomepizole, just look for whether ethanol is given. So in methanol poisoning, the antidote is fomepizole or ethanol. And in the case of ethylene glycol poisoning, fomepizole is the antidote. The same in the case of methanol poisoning. So fomepizole is the antidote for ethylene glycol poisoning. Now in the case of acetaminophen is the chemical name of paracetamol. So in that case, or in the paracetamol poisoning, the antidote is N-acetylcysteine. N-acetylcysteine. Now the fourth question, that is atropine. In the case of atropine poisoning, atropine is a anticholinergic drug. So in the case of atropine poisoning, you need to give a cholinergic drug, and the antidote is physostigmine. Physostigmine is a cholinergic drug, atropine is an anticholinergic drug. Now coming to benzodiazepine, like diazepam, in the case of benzodiazepine poisoning, the antidote is flumazenil. Now coming to cyanide, in the case of cyanide poisoning, the antidote is hydroxocobalamin. So if hydroxocobalamin is not there, another antidote is amyl nitrite in the presence of sodium thiosulfate, Na2S2O3. So either hydroxocobalamin or amyl nitrate in combination with the sodium thiosulfate, Na2S2O3. Now coming to digoxin poisoning, the antidote used is D.Pharm, that is the brand name, D.Pharm, or another belonging to same category but another brand, Digibind. So this is the antidote for digoxin poisoning. Basically they are digoxin specific antibodies against digoxin. They are digoxin specific antibody. D.Pharm or Digibind, they are digoxin specific antibody which is used as the antidote for digoxin poisoning. Now coming to the iron poisoning, the antidote is desferoxamine, or it's also called as deferoxamine. Desferoxamine is also called as deferoxamine, is the antidote for iron poisoning. Now in the case of isoniazid, the antidote is vitamin B6, which is also called as pyridoxine. Now in the case of organophosphorus compound, again they belongs to cholinergic category. In the case of organophosphorus compound poisoning, the antidote will be an anticholinergic drug. Definitely it will be atropine. Carbamate also belongs to cholinergic category, so definitely the antidote will be an anticholinergic drug, atropine. Now, very commonly asked question, the antidote for opioid poisoning or morphine poisoning. The answer is naloxone. Naloxone is the antidote for opioid poisoning or morphine poisoning. Now, coming to salicylates like aspirin, there is, although there is no specific antidote, normally the urine alkalinization will be the mainly done. Urine alkalinization will be done, or in the case of very severe aspirin poisoning, the dialysis will be done. So salicylate poisoning, urine alkalinization or dialysis is the method used. Now, coming to the beta blocker poisoning like propranolol, the antidote is glucagon. Same with that of calcium channel blocker, the antidote is glucagon. Now, coming to heparin poisoning, heparin is an anticoagulant drug. So in the case of heparin poisoning, the antidote is protamine sulfate. Now, coming to the last question, in the case of warfarin, the antidote is vitamin K. Vitamin K is the antidote. However, if warfarin poison is accompanied by severe bleeding, in the case of severe bleeding of warfarin poisoning, in addition to vitamin K, the major antidote will be 4-factor prothrombin, 4-factor prothrombin complex concentrate. So if warfarin poisoning is accompanied by severe bleeding, the antidote is 4-factor prothrombin complex concentrate, PCC, abbreviated as PCC. PCC is nothing but prothrombin complex concentrate. The full name is 4-factor prothrombin complex concentrate, or FFP, fresh frozen plasma. So if the question is what is the antidote for warfarin poisoning with a severe bleeding, look for either PCC or FFP, that is fresh frozen plasma or prothrombin complex concentrate, in addition to vitamin K. So the answer to today's question, ethylene glycol poisoning, the antidote is fomepizole. Answer is D choice. Thank you.